My name is Carla Hoffey, and today I'm going to discuss aneurysms with you. How many of you are familiar or have been affected by aneurysms?
My grandma died at 73 of a brain aneurysm.
Anybody else?
I had a first cousin who passed away of a brain aneurysm in his early 60s, and then an uncle that had a stomach aneurysm, and I think he was in his 70s.
My papa had one and he was 73, passed away from it.
So in the U.S. today, there are 6.5 million people walking around with unruptured brain aneurysms. That's 1 in every 50. 30,000 brain aneurysms will rupture this year. Of those cases, 50% will be fatal and 15% won't even make it to the hospital. First, let's discuss what is an aneurysm. The American Heart Association states that an aneurysm occurs when your artery wall begins to weaken and it widens abnormally. The exact cause of aneurysms is unknown. Some people have been born with them. Other people experience them after some kind of head trauma. Now that we know what an aneurysm is, let's discuss the symptoms. The B Foundation states that aneurysm symptoms occur suddenly. They include low blood pressure, rapid heart rate, pain, vomiting, nausea, and going into shock. If you have a family history of brain aneurysms like I do, then you're slightly increased risk for developing an aneurysm. Although aneurysms are known to be hereditary, most aneurysms occur from choices of bad habits. To protect yourself from aneurysms, you can eat healthy, exercise, and take your medication. Choosing not to smoke, managing your blood pressure, cholesterol, and diabetes will also help protect you from developing aneurysms. Let's discuss the treatment options. The Brain Aneurysm Foundation states that your best way to detect an aneurysm is to have a CAT scan or MRI. Not all aneurysms need to be fixed. If an aneurysm is under 5.5 centimeters, the doctors will choose to just monitor it. If it grows above 5.5 centimeters, then the doctor will choose whether it's time for surgery. Surgery can always be serious, so the doctor will weigh the odds. In surgery, the doctor will choose whether to place a stent in the artery or to clip the aneurysm. Today, we discussed aneurysms. They can be fatal if not treated. If you have underlying causes or a family history, I suggest that you have a preventative test done. One test just might save your life. Does anybody have any questions?
I'd heard that a high sodium diet creates a more likelihood that it would make the brain aneurysm worse. Have you heard anything like that?
Yes, in my research I found that sodium has a major impact on aneurysms occurring. Does anybody else have any questions? Thank you for your time.